Hi everyone, I'm Jenna Callahan from the Powassan Area Family Health Team, and this is the Mindfulness series. This video has a specific focus on pain and how pain can be addressed using tools of mindfulness. So pain is a very individual experience and it's a very broad topic as well, right? Overall, we know that pain is an electrical signal from our nervous system that gets sent from our brain from whatever nerve in our body is being hurt to let us know, like, hey, something's going on here. So when I'm talking about pain, I don't want to be too specific on whether I'm talking about chronic pain, headaches, aches, muscle tension, any of those types of pain. All of them are very legitimate. Most of the research has been done on chronic pain because that's something that is persistent, that kind of needs that extra care and attention, as opposed to something which is like quite immediate and then goes away. So that's where most of the studies tend to fall. With chronic pain, what we're seeing is that even after the pain and the tissues have healed, the pain signals are still being sent from that part of the body up to the brain. Chronic pain is defined as pain that's been lasting longer than 3 months, or past the normal time for that tissue to heal. So, obviously, with some things like bone breaks or like severe burns, um, it would be quite normal for pain to last a relatively long time, unfortunately. But this would be like if all things upstanding, if there's still pain there, then for longer than 3 months, it could be identified as chronic pain. Chronic pain can lead to a lot of significant medical, social, economic consequences. Not only that, but it can lead to relationship issues, lost productivity, and larger healthcare costs, depending on what those may be as well. Overall, pain just has a large interference with our functioning. If there's, issues of pain within particularly like the back, the core, the legs, the hands, we're talking about like something like arthritis, um, that can impact the way that we move about our daily functioning and our daily lives. And associated with that is a heavy emotional toll as well. With pain, we can see this fixation that can occur based on the reality that pain wants attention. That's the point of it. It's sending a signal to the brain for us to pay attention to that part of our bodies. So there can be a fixation associated with, okay, I can't focus on anything else but the fact that I'm in pain all the time. And the emotional toll that's associated with pain can be leading into really serious psychological disorders as well. We're talking about potential substance abuse. That's kind of a big underlying theme of the opioid crisis that we're experiencing right now is very normal, everyday people are suffering from pain and going to get medication for it, and then they become very heavily dependent on this medication and they need more as time goes on to still stifle the same amount of pain, but they just need more of it. Um, and not only that, but it can also be associated with depression as well. Um, there's a very heavy correlation with pain and depression. Of course, sleep can be impacted, just general irritability and fatigue, whether it's fatigue of the like mental kind or fatigue of the physical kind as well, where it's difficult to do things because they hurt and because our body hurts. And these emotional tolls can make getting better much more complicated than a matter of just addressing the pain. So, mindfulness overall is defined as being present in the moment, being aware of thoughts, feelings, sensations, and the environment, and the acceptance of everything as it is. So, that already may spark some people's thoughts of thinking, well, sensations and feelings, I'm in pain. I don't want to focus on these things, nor do I want to accept them. Bear with me. We're going to get there. um, so, the practice of mindfulness is to try and stabilize the mind, decrease our running, overarching thoughts, and to just be able to become fully absorbed within a state of concentration. And typically, it's using techniques like breathing or visualization, body scanning, things of that nature. And hopefully, through a practice of mindfulness, there can be an increase of awareness, which assists in ourselves identifying and understanding thoughts that bring on distress and dysfunctional behavior. So, in relation to pain, the point of mindfulness is not necessarily to stop the pain because that's very wishful thinking. The overall goal is to change the relationship that one has with pain, kind of like what I said before of us accepting pain and being able to address the sensation that's going on within our bodies. So there is an association of mindfulness meditation being a significant improvement of the things that are associated with pain as well. So what I talked about with mental health and physical health. So mindfulness can improve those things and also help with the rates of depression, addiction as well, and those fatigue and sleep issues. So it's kind of like what we say that, mindfulness can be a tool where we're scanning our bodies and we're trying to pay attention and focus with our bodies, which is very counterintuitive of what we think we would want to do when we're experiencing pain. But changing that relationship is looking at the pain, giving it attention, approaching it with curiosity and openness, and gratitude and saying, thank you for being there. I recognize you. I hear you. And I accept you. And in that, the feelings associated, like the feelings of frustration and anger that we have towards our pain, can be let go, hopefully, with practice. So that's kind of where this relief comes from while we're in our moments of our own discomfort, is if we can, instead of avoid, if we can draw purposeful attention, then it could be very beneficial. And like I said before, mindfulness does target those psychological effects of pain. And I talk about those more thoroughly in other videos, which you're more than welcome to check out as well. So, what we're trying to do when we're being mindful, as I've kind of listed here, is to decrease that fixation as we go about our day. So, once the mindfulness practice is over and we've given our attention to our pain, wherever it may be, we can say, okay, I gave it attention and I want to focus on something else now and be able to have that fixation gone because we've already accepted the pain for what it is. So that's part of the improving acceptance as well. And also, hopefully, to enhance self compassion and that feeling that we're worthy of still enjoying our lives and we're allowed to feel pity for ourselves for having pain and not feeling very in control. That's a hard thing for people to accept. And that deserves a little moment of, yeah, I can only work at 50% capacity because that's all I have. Um, so that's that self-compassion piece. And what we're trying to do as well is encourage that relaxation response, which can overall lower rates of literal tension that we're holding in our bodies, whether we know it or not. So we can ease that pain a little bit as well. And there is some evidence overall that mindfulness does have the ability to reduce pain intensity as well. So maybe starting at a 10, but moving it down to maybe a 7, maybe a 6. I don't know. I don't want to throw like miracle numbers out there by any means, but there is some evidence that suggests that. So attached to this, video is a guided meditation, and it's about 10 minutes long, and it's me doing it. And it's specifically related to pain and pain reduction using meditation. So if you want to give that a try and see if it works, I'd be very curious to know what you think. Um, yeah, hopefully it works well for you. And finally, here are some resources attached. Some of these may look very similar to other videos if you watch them already. I always have the apps, the Insight Timer, which is free, Headspace, and the Calm app, which both of those are paid. Um, but if you are very, very much intrigued and have a spare $100 or whatever it is, you can absolutely have that as well. But the Insight Timer is free, and you can always look up things that would be purposeful and helpful for mindfulness meditation related to pain. Whether that is like you can probably search pain or search body scanning, search relaxation. Also, just in YouTube, if you have the moment, pain guided meditation. I've done it myself, and there's some really good ones up there. Headspace is now on Netflix, which is amazing. And here are some books and workbooks that can be beneficial as well. The Mindfulness Solution to Pain is great. It has Dr. John Kabat-Zinn in it, and he's kind of the father of modern medically associated and researched mindfulness. So he's kind of like the guy. Uh, there's the book You Are Not Your Pain, which is mindfulness based as well. And finally, Healing Through Mindfulness, Effective Practices for Chronic Health Conditions. So check out those resources if chronic pain or pain in general is something that you experience. And I hope that you find value in them. And I hope that you can find some relief. Thank you so much for listening, and enjoy the rest of your day.